Your genes determine observable traits such as eye and hair color. They can also determine how you react to certain medicines. Let's use clopidogrel as an example to explore how medications can work differently for patients based on their genes. Clopidogrel, sold under the brand name Plavix, is a medicine that helps to prevent blood clots, which block the flow of blood. A blood clot is an aggregate of red blood cells, platelets, and a mesh of fibrin protein. Blood clots can protect you from excessive bleeding if, for example, you cut yourself. If a blood clot dislodges and travels through a blood vessel, it can block blood flow and cause serious medical issues such as a heart attack or stroke. Because clopidogrel prevents platelets from clumping together, it is often prescribed to patients who are at risk for these conditions. Clopidogrel is taken orally as a tablet. It's an inactive prodrug until the body processes it into an active metabolite. Once ingested, clopidogrel is absorbed from the intestine and travels to the liver, where it is metabolized into its active form. In most patients, clopidogrel is activated by a series of liver enzymes, including the key enzyme CYP2C19. CYP2C19 is a member of the cytochrome P450 family of enzymes. In a multi-step process, liver enzymes, including CYP2C19, first convert clopidogrel into an intermediate metabolite, and then to the active clopidogrel metabolite. The active metabolite is released by the liver and can enter the bloodstream to prevent platelet aggregation. Normally, when a blood vessel wall is damaged, platelets release a signaling molecule called adenosine diphosphate, or ADP. ADP binds to the P2Y12 receptor on the surface of other platelets. This binding triggers changes within activated platelets that facilitate their aggregation to form a blood clot. Active clopidogrel metabolites can bind to P2Y12 receptors in place of ADP to stop the ADP signaling that normally causes platelets to stick together. Reduced platelet aggregation lowers the risk of blood clot formation in arteries where they could cause a heart attack or stroke. Clopidogrel activation depends on the CYP2C19 enzyme. The gene that encodes CYP2C19 is located on chromosome 10. Most people's genome encodes a fully functional version of the CYP2C19 enzyme, which allows clopidogrel to be metabolized and work as expected. However, some people have genetic variants or differences in their DNA sequences, which may involve changes of just one or a few base pairs. CYP2C19 enzyme activity can be altered in individuals carrying such genetic variants. In patients with certain genetic variants, the CYP2C19 enzyme works more slowly or not at all. Clopidogrel activation is limited in these patients, so the drug can't prevent blood clots from forming. Even if these patients take the medication as prescribed, they remain at risk of a heart attack or stroke. Other patients have different genetic variants that make them ultra-rapid or super metabolizers, so they metabolize clopidogrel too quickly. Because too much of the drug is activated at once, these patients may have trouble stopping bleeding. This increases the risk for conditions such as hemorrhagic strokes and cerebral bleeding. To circumvent such outcomes, doctors today routinely use pharmacogenetic testing to inform treatment decisions. They analyze a patient's genetic information to predict how well they will respond to medications such as clopidogrel, helping clinicians to select the safest and most active dosage of the drug.